Hello, my name is Darlene. I'm the APR that's going to be assessing you today. Can you tell me your name?
Rick.
Hello, Mr. Rick. I'm just going to go ahead and get into it. I'll start by assessing your head.
Okay.
So there is a receding and thinning hairline. There is a scratch on the left forehead. There's no palpable masses, no other lesions present. Is there any tender spots?
No, ma'am.
Posterior fontanelle closed at 2 months, and the anterior fontanelle closed at 18 months. I'm going to palpate the pinna, the tragus, the mastoid process here. Is there any tenderness present?
No, ma'am.
Can you clench your teeth for me? I am palpating the temporal mandibular joint. Can you open and close your mouth a couple times? Perfect. There's no crepitus or swelling noted. Is there any? Was that tender at all?
No, ma'am.
TMJ, the temporal mandibular joint was non-tender. I am now going to look on the outside and the inside of your ears. Outside of the ears, there's no redness, no swelling, no outward appearance of drainage. I do see you're wearing hearing aids. Can you take those out for me, please?
Yes, ma'am.
I am now looking at the tympanic membranes. Tympanic membranes are pearly gray in color, and cone of light is seen at 5 o'clock in the right, 7 o'clock in the left. There's no signs of perforation, retraction, or bulging in the tympanic membranes. No signs of cerumen in the ear canals. I'm now going to assess your hearing. Can you put your hearing aids back in, please, sir?
Yes, ma'am.
And I'll have you stand facing my desk with your back to me, please. I want you to cover your right ear. I'm going to whisper a series of letters and numbers. I want you to repeat them back to me, okay?
Okay.
One step forward if you can. Perfect.
EL5.
Cover your other ear. And
JM2.
all right, go ahead and sit for me. I was testing cranial nerve 8, vestibular cochlear, cranial 8 intact. I am now going to take a look at your eyes. So I'm just going to do a quick inspection. There's no redness in the eyelids. There's no infestation in the eyebrows. No lesion in the eyes. No periorbital swelling. Conjunctiva is pink. Sclera is white. His irises are brown. There's no signs of drainage either. I'm going to dim these lights, and I'm just going to take a quick look at your eyes. So I want you to look at my nose, and I'm going to shine this light down. Okay? Just one at a time. Pupils constrict, testing cranial nerve 2 optic. Turn the lights back on. I'm still testing cranial nerve 2 optic, so I'm going to have you, again, look at my nose. Keep your head at right where it is, and follow my pen light with your eyes, okay? Pupils constrict and eyes converge. I'm now going to test your visual acuity with the Snellen chart, so I'm going to hand you this eye cover. I want you to sit on the far end of the couch for me.
Okay.
I want you to cover your right eye, and I want you to read that bottom line for me.
LTFPH.
All right. Now cover your left eye, and do the same with and read the same line with your right eye.
LTFPH.
Visual acuity is 20/20. Cranial nerve 2 optic is intact. Now you can just take a regular seat for me.
Okay.
I'm still testing cranial nerve 2 optic. I'm going to have you cover your right eye, and I'm going to cover my left eye. I want you to keep your head as if you're looking at my nose.
Okay.
And then I want you, and keep your eyes looking at my nose. And I want you to tell me whenever you see my fingers come into view, okay?
Okay. Now. 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 Now.
Okay. Now, swap eyes. We're going to do the same thing. Look at my nose.
Now. 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 Now.
Okay. Cranial nerve 2 intact. I'm now going to take a look at your nose. So first I'm going to touch your nose, and septum is midline. I'm going to take a quick look inside. There is no redness or swelling on the outside of the nose. Just look up, and then I'm going to gently pull your nose up. So inferior and middle turbinates are seen. They are a little red and swollen. There is some congestion present and some clear nasal drainage. I'm going to palpate your sinuses. So you tell me if this is tender. Is that tender?
No, man.
Okay, frontal sinus non-tender. Now I'm going to just push on your maxillary sinuses. Are those tender?
No, man.
Alright, sinuses non-tender. I'm now going to test cranial nerve 1 olfactory. So what I'm going to do is have you plug one nose or nostril and close your eyes. And I want you to try to identify the scent for me.
Peppermint.
Okay. Now I want you to occlude or push that nostril closed. And I'll do the same thing with the other side.
Okay. Lemon.
Perfect. All right. Cranial nerve 1 olfactory is intact. I'm going to test cranial nerve 5 facial. So I want you to close your eyes, and you're going to feel me touch your face with this Q-tip, and I want you to tell me if it is equal on both sides.
Yes, ma'am.
All right, cranial nerve 5 facial is intact. I'm now going to take and look in your mouth. So first, I want you to open and close your mouth. And close it. Perfect. Lips are able to fully close. They're pink in color, symmetrical. Can you smile for me? Can you frown? Can you raise your eyebrows and then close your eyes shut really, really tight? Really tight. Perfect. So facial symmetry is intact. I want you to open your mouth. Teeth are intact, no normal color, no discoloration present. Oral mucosas, pink, moist, and intact. Say ah. Soft palate and uvula midline rises. Cranial nerve 12 hypoglossal intact. I want you to stick out your tongue now, please, sir. Say ah. The tonsillar pillars are present. No exudate or swelling or redness noted. Oropharyngeal space is open. When we stick out your tongue and move it side to side. Okay. Cranial nerve 12 hypoglossal is intact. Cranial nerve 10 intact. Vagus nerve. I'm going to have you take a drink of this water, and I want you to hold it until I tell you to swallow, because I'm going to test your cranial nerve 9 glossopharyngeal and cranial nerve 10 vagus nerve while I am also palpating your thyroid.
Okay.
Okay. So, all right, hold that in your mouth. Look down a little bit. Now swallow. Okay. Thyroid is midline, rises with and lowers when swallowing. No trouble swallowing. So cranial nerve 10 is intact. Patient has had no trouble speaking, has had no dysarthria throughout the entire exam. Cranial nerve, non-glossopharyngeal and cranial nerve 10 vagus intact. Now I'm going to palpate your lymph nodes. If you can just sit up for me. I'm going to start with your occipital, your posterior cervical, your anterior cervical, your pre-orbicular, post-auricular, your subtonsillar, submandibular, and your submental. Shrug your shoulders forward, push your shoulders forward there. Your supraclavicular and infraclavicular. Alright. And then I want you to raise your arms like this for me. Just kind of thinning a little bit. There we go. Auxiliary lymph nodes. Start with this one. Epitrochlear lymph nodes. Relax. All lymph nodes are non-palpable, non-tender. I am now going to move on to the respiratory portion. If you can, please take off your shirt. Okay. I am going to listen to all of your lung sounds. If you can, stand up for me. Take a deep breath in. Okay, let's see. Take a deep breath in. Okay. Now take a deep breath in. Not for me, please. Can you turn around for me, please? One more time, just a little bit. Thank you. All breath sounds are clear, equal, in all lung fields. No adventitious sounds present. I'm going to do some tactile formulation. So every time you feel my hands touch you, I want you to say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon.
Tactile formulation is current, is present, and equal in both lungs. I'm now going to test your chest expansion. Let's take a big deep breath in. One more time. Chest expansion is symmetrical. All right. I am now going to percuss your lung sounds. We'll start with the back. Okay. Raise this arm for me. Raise this arm for me. All right, and then turn around, please. All right. All right. Resonance is equal throughout all lung fields. I'm now going to take and assess for any kind of crepitus. No crepitus felt throughout. Respiratory rate is regular and rhythm is regular as well. No use of accessory muscles or increased work of breathing present. I am now going to have you sit down for me and I will listen to all of your heart sounds. So the diaphragm, I'm going to listen to your aortic, pulmonic, herbs, tricuspid, and your mitral. And now with the bell, I'm going to do the same thing. So aortic, pulmonic, herbs, tricuspid, mitral. S1, S2 present. I'm now going to have you lean forward, and with the diaphragm of my stethoscope, I'm going to listen to your aortic valve again. So when I tell you, I want you to take a big deep breath in, exhale all the way, and then hold it, okay?
Yeah.
Big deep breath in, hold it, or exhale, hold it. No aortic stenosis present, no systolic murmur heard. Excuse you. Excuse me. Oh, bless you.
Thank you.
So now what I'm going to have you do is I'm going to have you lay back, and I'm going to assess for some jugular venous distension. Bless you. Just kind of slightly look towards the couch just a little bit. No jugular venous distension noted. I am going to have you now lie fully on your back. And I'm going to inspect for any heaves. No heaves noted upon inspection. No heaves. Arterials palpated. Palpating the point of maximal impulse. Point of maximal impulse palpated at the fifth intercostal space. I'm going to have you lay on your left side. I'm going to listen to your mitral valve. No mitral stenosis present. No mid-diastolic murmur heard. I'm going to go ahead and have you sit up for me. And I'm going to listen to your carotid arteries with the valve of my stethoscope. No breathe heard. Now we're going to palpate your carotid arteries one at a time. Pulses +2 bilaterally. My birds are fairly palpated. And then almost forgot to check your trigeminal. So I'm going to have you close your eyes and I'm going to touch your face with
Yes, ma'am, I do.
Alright. Perfect. Well, that's it for our assessment today. The anterior posterior ratio is 1 to 2 is normal. No lesions, no bruising, no signs of trauma noted on the chest wall, thoracic cavity on the outside. I think that's it for today. Thank you for coming in.